Actually, let me jump into some of these calls first. Robert, Detroit, Michigan, the great WJR country, a Democrat. Go.
How you doing, Mr. Levin? Do you mind if we dance for a second?
Go ahead.
Okay. First of all, what joy do you Republicans get out of having a whole bunch of the electric population walk around sick and can't afford health care?
All right, let me explain something to you, pal. Number one, I'm a conservative. And I am a Republican, but a conservative first. You Democrats don't get that. Number two, what do you mean walk around people sick? We have massive unemployment in this country. If people could get a job, they'd be able to purchase their own health care, or their employer would be able to provide it. How does raising taxes on... You're in Detroit. Look around, my friend. That's a liberal experiment gone wrong. The Democrats have run Detroit now for what, 40, 50 years? All the taxes you've ever wanted, all the regulations you've ever wanted, all the health care rules you can impose on local business, and guess what? It's broke. And now there's more suffering, and there's more misery. Let me explain something to you, because I don't have a lot of time. This is a public service to you, my friend. Let me explain something to you. The government getting involved doesn't create more health care. It creates dislocation. It doesn't create more wealth. It creates poverty. When are you going to give up on big government and big taxes? When are you going to see it with your own two eyes? Go ahead.
Helping people who's sick, and why would you condone...
Helping people who's sick. Everybody who gives somebody a job is helping somebody when they get sick.
Okay.
Pal, you're not even listening to me because I can't get through to you.
Oh, yeah, I'm listening clearly.
Putting small businesses out of work in Detroit doesn't get people a person who's sick health care. Hold on now. You listen. All right, get out of here. A drone. I can't help the drones. I can't help the drones. A healthy economy, which can only be built through a market system, creates more health care for more people, more advanced health care for more people than any other system on the face of the earth. Detroit, the inner city of Detroit, in many respects, it has been an experiment of the far left. They've controlled it. They've done whatever they will do. It's a one-party system. And for the most part, there's destitution wherever you look. And I speak as somebody who wants Detroit to succeed, who wants that metropolitan area to get better. But it's not going to get better through government and taxes and redistribution of wealth and punishing the only model that can fix it, capitalism. We'll be right back. Okay. Why shouldn't let me deal with this in the abstract. Why shouldn't people who need health care get it? Shouldn't it be a right? Now listen to that statement. Is that the statement of a mature mind? You have to have doctors and nurses. You have to have medicines. You have to have equipment, devices. You have to have facilities. Those facilities have to have utilities. And I can go on and on and on. To say that somebody has a right to something, there are scores and scores of people for that one person who have to get a special education, to become professionals, who have to develop certain medicines over a period of 20 years at great cost, who have to develop certain devices. And they're all driven by altruistic motives, including, in most cases, to create wealth and secure private property. This is what the left will never understand. So I get a call. Don't you think everybody should have health care? What do you mean, don't I think? Should we enslave doctors and nurses, inventors, people who work at labs, scientists? Should we enslave them all and make sure that they produce health care? I mean, what does this mean? Shouldn't everybody get health care? The system that creates wealth in the form of health care or material needs for the most people is the system that the left hates. It's the system that that caller hates. It's the system that the modern Democrat Party hates. It's the system that the president's at war with. If you're going to destroy the liberty of interaction for the purpose of creating wealth, you destroy wealth, you destroy jobs, and yes, you destroy health care. Universal health insurance coverage is not the same thing as universal quality medical care. They're two different things. The government cannot do the latter. It can, by law and force, do the former. It can force us all to accept a one-size-fits-all health insurance system. It cannot provide us with quality medical care.